prayer. Ewe Mwenyezi Mungu ambaye kwa hekima na wema wako umeteua nyadhifa za viongozi na mabunge kwa ustawi wa jamii na utawala wa haki wa wanadamu, twakusihi ututazame kwa neema nyingi sisi watumishi wako ambao umeridhika kutuita ili tutekeleze shughuli muhimu za jamhuri yetu. Twakuomba ututeremshie baraka zako sisi tuliokutanika hapa, na utujalie tuyatende na kufikiria mambo yote yatakayofikishwa mbele yetu kwa njia ya haki na uaminifu, ili utukufu na sifa zako ziendelezwe, na ili kustawisha amani, ufanisi na heri ya nchi hii yetu na wale ambao haja zao umezikabidhi mikononi mwetu. Honorable members, we are going to first swear in the nominee. You profess which faith?
Christian. I, Kaburu, swear by the name of Almighty God that the information I'm going to give shall be the truth, nothing but the truth, so help me God.
Thank you. So we are going to start with introductions. My name is Honorable Mohammed Roba, the chair of this committee, the Selection and Appointment Committee.
Good morning. I'm Honorable Rashid Ali, the member of the committee.
Majina mileto mwesimu Asante Kiambi, MC wa Vera Ward, I was the chair.
My name is Major Bulija, MC Chariwa. I'm your former chair, and I know you are Arwa.
My name is Fatuma Abdullahi, nominated MCA and member of this committee.
Honorable on record.
Honorable Bakar Abdigodana, MC of Pasarito, and also a member of this panel of selection and appointment.
I'm Honorable Amina, nominated MCA member.
Technical team.
Adam Bonaya, committee clerk.
Safia Abdi, legal counsel. I'm Fatuma Aden from the Hansard department.
Mohamed Happy Sajid Hatam.
Mind the Amos. Chief ICT.
Thank you. Lucy, welcome. We are here to let you if you are suitable for this position, where you will be nominated by the governor and the health department of the county. So you will start by introducing yourself and tell us why you think you are qualified for this position.
Thank you. Please. Okay, thank you, Honorable House, Honorable Members. Good morning. Me here is Lucy Kaburu, who is a mother who is a wife and a long-serving civil servant. First and foremost, I'm greatly honored for the appointment of the position and for you giving me your time so that you can go through the process. Thank you for the conducive environment. Thank you, Mr. Speaker. I think I'm suitable and fit for this position because one, I'm a long-serving civil servant. I clearly understand the processes, procedures, policies, and plans of the government, from the national government to county government. I've also served in different capacities in this county. I started with the national government, where I was a clerical officer by then. I developed myself and also trying to venture in the county and see how I can best make this our county succeed. That is when we were devolved from the national government. I came in as a trade officer from the national government, and somehow our HR and our gap capacity in this county, and because I am done human resource, I was a profession in human resource, I was seconded still to the human resource, and I still served our county. The system that is on now for the records of the staff, I was one of the implementers. And after that, I was appointed as a chief officer for trade, cooperatives, and SMEs. That was in the previous government. And I performed to my best. That's why even the government recommended me and appointed me, and you gave me the opportunity to be a chief officer again of trade, investment, and industrialization. So from the knowledge that I have, the know-how of the county, and also I'm conversant with the issues around the county, our shortcomings, our strength, and also I have you as a support system to support me deliver this big agenda of health issue in the county. I am sure, Mr. Speaker, I'll be able to carry on the role that I've been appointed to in this county and make it a better place for all of us, because we all know that health is key issue to us all, and without health, we cannot perform our duties. So I'll give it my best, I'll give my expertise, my knowledge, and through the support of other government systems, I'm sure I'll deliver. Thank you.
Lucy, you said you are an HR professional. How can this help the health department, your profession?
Okay, thank you, House and the Speaker. First and foremost, in every organization to perform, even in the assembly, human resource is a key aspect. If the human resource is not motivated, is not ready to work, is not giving its best, the structures, the infrastructures cannot work for the community and our county. So the aspect of human resource, especially for the staff of the health, I know somehow they are very demotivated and they really need someone to lift their spirits so that they can give their best. In health services, I believe that when a patient is handled by a doctor or a nurse, the first impression of that nurse to the patient can even heal the patient, even without the medicine. Just the receiving, the giving the quality services. Even though one or two things there might be a gap, the service, quality service that will be accorded to that patient definitely will heal. And you see these days, we have a lot of dynamics. Most of the sicknesses are psychological. Others are social problems. They don't even require medication. Others are terminal diseases. So the quality service, the support that you can give that patient can really go a mile ahead. Also, you can see the shortcomings of the service delivery in our health services, especially the strikes. How can you address the issue of a strike if you are not so close with the human resource? How can you get their views? How can you address their issues? So human resources are key, and I think in every aspect of organization or leadership, it is a key requirement. Thank you.
Thank you, Honorable Speaker. In your set of questions that you addressed to our nominee, in answering that question, she responded by saying, I think. Certainty in response is something critical that we need to address when we are nominating someone for a critical position such as here. So you must be confident by saying that I can, not by saying that I think. It means that you are not sure of your capacity. The County Assembly of Isiolo is always appropriating a sum of 1.2 billion to the Department of Health. That is a motivating amount for any serious CC to work with. This panel requires to know what motivated you to be nominated for this position and how best are you going to perform. You have been given a full establishment, that is the staffs are already there, the finances is available, but the problem of health is much appealing to the members of the public. Through your motivation of being a CEC nominee for health, how best are you going to perform?
Okay, thank you, Honorable Member. Thank you, Honorable Speaker. I am sure, let me confirm that I am sure I'll be able to lead this department and to perform in this department. Thank you for the correction. I am sure. As I've said, I've been working in this county for long, and I think one of the key issues that I am nominated is because of performance. If I couldn't have been performing in other duties that have been allocated, I'm sure the appointing body wouldn't appoint me. And from wherever the department I was, I'm happy my chairman is here, and he has all the reports of what I was performing, what I was doing, and that is, I think, a key. I know it's a key aspect to perform, giving the best to the duties that you've been allocated. Find the healthy docket as you've sent as issues, especially the communities, but those issues have to be dealt with by a performer, a person who really knows what health department requires, just like me. I've been here, I've been raised on here, I know our dispensaries, our general hospital, the level 5, and I'm sure if we give the best, especially for the finances that you mentioned, if we clearly give strategies of where these funds should go and do a plan very well, this amount is really a good amount to take to the next level the services of our health sector. And again, I'm not coming there to reinvent the wheel. We should clearly look at the strategies and the approaches that are used in delivering the services in the health sector. And that is why I'm saying that with the support of the existing system, government system, we look upon it and do some clear plans and action plans. I'm sure we'll take the health services to the next level in this county.
Thank you. Your predecessor was a medical doctor, the Honorable Lowassa, our deputy governor for Isiolo.
Are you sure he was a medical doctor?
Going by the name given, the doctor means that that person has attained the professional qualification required. That is a subject for discussion for another forum. But he has not been performing to our expectation. The changes must be necessitated by the response of the public. He wasn't performing to our expectation, being given the title of a doctor, which is in question now. I want really to ask, in your response, I was expecting you to address two key issues. That is the referral system from the ward level up to our Isiolo General Hospital, which is the biggest hospital that we have in our county. I need you to elaborate for us how we will going to address that. Number two, there is a staggering issue of mortuary. The members of the public are crying. They are lamenting, the complaints are everywhere. Given the background information that the Isiolo County has no enough resource to implement everything to the fullest. But you are the CEC member. If you are nominated by this house, how will you going to address those two pertinent issues so that our governor will have a peace in delivering on other departments? You are the implementers of the policy. That's right there. So how will you going to implement and improve on those two key issues that members of public are complaining about?
Thank you, Honorable Speaker. Number one, about the delivering in the health department. As you've said, there are so many issues in the health department, but my first initiative will be to sit down with the technical officers, and as I'm the CEC, I'm not the only person who will change the health services. It is a teamwork of the technical staff, doctors, including our Department of Finance. That is how we'll have to achieve, because the budget is from the finance department. But all in all, the strategy that I'll take first is to bring all those plans, the way they do their works, to see what is what. Then we prioritize. For example, our dispensaries. I'm aware, I was in another department, but I'm aware there are some dispensaries in our interior wards which doesn't have, they have a one staff, and that one staff doesn't even report. So that is why I talked before about human resource. If you motivate, you capacity build, you be in good PR with the human resource in the service delivery section like health, I'm sure you will deliver. Number two, there are laying plans and strategies and policies, and maybe there are work plans in the sectors. I will sit down with them, re-engineer them and see where we should be. For example, we've talked about the morgue. That is a priority currently. It is a big priority. But what will happen if the budget is not there enough to do that morgue in a month's time as the communities expect? You see, we have to change some strategies here and there, some allocations here and there to give all the best to the priorities that we raise. Because my first priority is that of human resource, my second priority is for the morgue, my third priority is for the own revenue generation in that health services and how we can manage it well so that it can be taking care of most of the gaps in the health sector. Another issue is about the professionalism. At the level of the CEC, this is the leadership level, the management level. Because I've been a manager in other fields and I've been able to give leadership and management, I am very sure even in the health sector, I'll give it the best. I'm saying again, I won't be the treating medical doctor, but I will oversee the services given the medics and the staff of the health services. And that is what is important, because when they know their roles, when they are motivated and they are ready to work, they can give the services to their maximum. And as you are talking about the upgrading from the dispensaries which we have, remember even in the communities we have the CHV who are part of supporting system, and they are doing a lot of work in this county. The volunteer CHVs in the communities. We should also sit as a sector now and see how we can incorporate, bring everybody on board, and each and every person to play his or a role as required by the law. And then we have a lot of staffs in this county who are not even on duty. And there's a gap in staffing. That will also be my key area to see that all the staffs are on duty they are doing what they're supposed to do, then the rest will follow. Thank you.
Thank you. The last two questions. I would like you to. This is a constitutional question. I would like you to address us on Article 10 and 32 of the Constitution. Just to give you a hint, it talks about the values and principles of the public service.
Okay, thank you. Thank you for the question, Honorable. That is the basic part of civil service and every organization, the principles and values. If as a civil servant you are not guided by these principles and values in the Constitution, you might not be delivering, or you might be doing something different. For example, integrity. That is one of the articulated article in the Constitution. If all of us, including me and you, have the integrity aspect of it, even the little resources that we have can really do great to this county. That is key. Also, you have to involve people. You have to involve people in every process that you are doing. For example, you're talking about a bog. How was the process done? People really have to give their voice in this. Accountability. When given such a responsibility like I will be given, I'm sure, I'm praying God, I'll be given, accountability is key. You have to be accountable. For example, even yourself, you're accountable to the people who elected you. Is it? We really have to be accountable. And when we are accountable, I'm sure those scarce resources can do at least something, not everything in the county, but you can deliver. Also, respect is a key value in civil public service. If I don't respect a person, I don't expect the same. So it has to be two-way, the respect. Then in another principle that is key, you really have to be responsible. The responsibility that will be bestowed upon me, how will I be responsible to this? So as for the Constitution article, those are very key issues, and one should be guided by them. Actually, it should be a dictionary in the civil service that you move with it every now and then. And I'm sure if you are guided, we are guided by this, the ethics, working ethics, we'll be sure you are connected.
Thank you. The last question from my end is that what will be the function of the CC member?
Okay, thank you, honorable members and the speaker. The CEC role, number one, is implementing the national legislation to the county. Because as county started, we never hand our own laws. We rely mostly on the national government laws, especially in the health department. Most of the policies and regulations are national or from the World Health Organization. So implementing those to the counties is one of the roles. Another role is preparing the county legislative laws and giving to the county assembly for consideration to be county laws. Another role is overseeing the processes and procedures of the county functions, then reporting. And another key role that I know all of you look at from us, and I will be one of the people who will be giving full reports of the county, and not just full reports, timely full reports to the county assembly so that you can make other decisions. Another role of a CEC is also advising the CEO of the county, because there are so many issues you are up to and there are some priorities. You really have to advise the CEO on these approaches.
Thank you, Honorable Speaker.
Thank you, Honorable Baka. Sorry, we have a new member, probably can introduce himself.
My name is David. I'm the Deputy Speaker of Isiolo County Assembly.
Thank you, Deputy Speaker.
Good afternoon, Lucy.
Good afternoon.
Congratulations on your appointment. It's not an easy job. And you are going into one of the most sensitive departments, more so for us elected members. who come from the far-flung wards will be on your necks. We pray that we will not have a rough time with you. Then, what can you...
Bakar, are you preempting the decision of this committee?
No, I'm giving her what is coming, what is the reality.
On behalf of the committee.
No, I'm just, that's...
You need to correct that.
I'm speaking as MCA for Sericho.
That's your opinion. Right?
That's my opinion. What can you do to ensure that the county achieves its priorities?
Thank you, Honorable. What I can do a lot of things, but to start with, I cannot handle all for the whole county. Let me be specific for the appointment that have been given. Giving from the health services, the health department, quality services to the county and the communities of Isiolo County.
Then, whether do you render any community services? If yes, where? Whether do you render any community services? That's, I think, apart from the professional, any community services you give out. Whether you are giving out any community services, that's, I think, outside the job.
Are you involved in any charitable
community
services?
Okay. Yes, I am. I am.
And where?
In this way, in the church. I usually go to church, and as in the church we give some. We have a family day every year, and I fully participate in this family day event because it is an agenda in the church to support the needy in the community. And as you see, the Catholic Church has so many other dispensaries around and other schools, we support it so that they can sustain those projects. Also, I'm a member of women groups.
Chama,
yes. I'm a member of a women groups, and you see I was in trade. I was trying to train them to do variance and savings and lending groups. You've heard about it. And how could I have shown them the model, which I'm very proud of. It has worked so well. I think even in your villages you've heard about them. If I was not one of them, so I have to show them how to do.
Last question for you. What Isiolo resident can expect from you if approved? What do you expect from you?
I know they have a lot of expectations.
Give us just one.
A lot of expectations. Me, what I can give for now, and I know I'll work on it, I'll repeat it again, giving quality health services in this county.
Thank you. We have friends of this committee, honorable members. If you have questions, you can ask parliamentary.
Thank you, Mr. Speaker, sir, and also the nominee. I think you believe and understand that the critical issues of health. And you also understand that the health department is a crucial department in the world, say the whole world, not only this year. We have crisis there, mate. We have nurses striking, clinical nurses striking, and more so, there's a big outcry in terms of the mob, which now is becoming a critical thing at the top of the whole county. And also see some members of the public going ahead trying to see how they can donate to build their own work, just because the county government have failed to do one, which is now still in a critical condition. As now the CC of the health department, what will you now tell the people of Isiolo that when we are at seat, you make sure that you can try to tune the turn up what used to be there now in a different phase? That is my first question. Second question, Isiolo is our first county and very remote, as you know. We have an issue that if a mother delivering in the farthest part of this county, Toko, Lunyuro, or end of the Sericho, which is the farthest corner in this county. Due to the one, starving. Second, even the know-how of how to do some deliveries, which are being sometimes critical. That person needs an ambulance, and ambulance is not working. We know we have a number of ambulances who are not working. All you policies committee and you can do to ensure that the delivering mothers will not die in the remote area due to their transportation from where they are to a better facility that can make them to get that services. And my last question. We have a shortage of nurses and clinical officers in the whole country, especially the remote area. And we are trying to see the gap is a bit high if you are trying to look the human resources of that department. And also, the department have a very big wage bill compared to other departments. And reason being that the biggest number that are being employed are not in service class. They're just those people who are within the, who are just there, I don't know which level of service, but they are not the service class. Because we have tried to do the same as the Department of Finance. We are getting that problem that we have a big number of wage bill, consuming the high number of wage bill, but still the caregivers are very few. So how will we transform that to ensure that the required laborers are being put in place or being employed so that they can give those services to the people? Thank you, Mr. Speaker.
Thank you, Honorable Mantira, and the Speaker. Let me start with the morgue. I think slightly before you came in, I was explaining my priorities in the health sector, and one of the key priorities is the morgue, whereby the morgue are also a beneficiary. As Christians go to morgue, and I know my community and other residents of Isiolo have really lamented about it. I told this Honorable House that I'll go and look at the strategies which are there, because I know there's something going on with the morgue. There was an attender of the morgue, but since I was not inside there, I don't know the clear position and status of the morgue. That will be a key, one of my first things that I'll approach. I was explaining to them that making that modern morgue that the community want might not be effective in the few years that you've come. I trying to check about the budget of coming up with these morgues and the machines. It is quite expensive, but it can go in phases. I'll have to take it in phases so that at least, you see the one we had under capacity, very low capacity of around 20. If we can have around 100 capacity in the first phase, I think we can still continue developing more. Also, I was talking about the checking on the own revenue source, the revenue that is generated in the health sector. I think if well managed at the budget from the county, we can address some of these issues which we prioritize, morgue being one. The question number 2 about our county, I know it is vast. I also talked about it, the far-flung counties and the dispensaries where most of them are not even working. I think in our health sector, fine, we don't have so many medics and the numbers, but the staff that is there currently, if they have not retired or transferred, referring to the normal institution that I have from the PSN, they are quite a number, and I'm very sure either a medic, a clinic officer, or a very senior nursing officer can be deployed to these our dispensaries. And again, not even the issue of deployment is one. Number 2, there are some who are on duty and are not reporting. For example, in your ward, I went around after I saw the advert of nomination. Roro something, Roro. There is an officer there, but he never reports. Whose fault is it? It is the department. So we can still manage the staff that is there and take care of the services around the county as we recruit. And also I have a fear, I'm waiting for the audit report that the auditors are doing to see the human resource. You've seen so many times that you've been addressed that we have a wage bill, which is over and above 35%, which is a requirement. So as we streamline the report and recruit, give the word recruit, we really have to work with what we have. And I know we have enough. And again now, what the another step that I will take, the non-medics staff, there are so many in the health sector, and I'm sure most of them never even report. Why can't we distribute to other departments that are recruiting and get a space to recruit the doctors or the clinic officers? So if we sit with the CS and the public service, we can align the staff, the support staff, the clericals, we distribute them to other sectors, then you can get a space to employ new officers. I'm aware there's a new firm in health sector, Shifco or something. They have recruited some few staffs for us. But now I'm imagining the level 5 and staff. And then these staffs are still deployed in the same level 5. Well, they did good when there was a strike. They were the ones who were handling the issues. But now, how can we distribute them at least in our dispensaries? We have someone at a high level in giving services. Talking about the ambulances, I've talked about learning some strategies and some systems. Ambulance is one key issue in our county, and I'm very sure the cost of repairing, even without buying another one, is not so high. If given focus, if clearly budgeted for, we can revive, and I know, I'm sure we will revive those ambulances, and at least strategically set around the county, maybe at sub-county level, because you cannot take them to once, they are very few at sub-county level. And when we have those medics there, the nurses, the qualified nurses there, they can do referral smoothly and transport our mothers to the referral hospital. And again, there is also an issue of medication, not only the staff. We've been hearing around the county that there is no access of medicine, and I'm not very sure about
Medication
drugs. The drugs. Yes. The drugs. There is also an issue of the drugs. Also, when I get there, we'll sit with them and see how we can manage our own sourcing of drugs from KEMSA. You see, it's just payment. And I'm sure that the revenue that we collect in health services, if well accounted for, they can support the drugs. Are those the questions?
Thank you. Another member?
Thank you, Honorable Speaker. I would like you to address the panel on the key issue, that is the budget making process. There is a fraud in budget making from, I think, around the country. But to be specific, I would like to single out two main issues in budget, the fraud that I'm talking in the budget making process. Number one, we are having a problem with allocating a huge sum of money to the payment of casualties in Department of Health. Those people are never paid. That is not only from Department of Health, from any other department who have been under Department of Tourism, which is facing also the same problem. The fraud that I'm talking about, we are allocating from the exchequer a sum of money amounting to around, I don't remember exactly the figure, but a huge sum of money is being allocated to the payment of casualties. I'm saying they are never being paid. Under the FIF, they are also allocated money for them to be paid. The payment, we really need to know why they are not being paid. When we ask during the budget scrutiny, we have been told that they are providing a very critical services. If someone is offering a very critical services and a cash of almost an year or so, it means that the criticality part of that service will be in question. Because if they are really needed, they have to be employed. They have to go through the formal process of employment. That has never been done. We are allocating them in our budget, and under FIF we also do the same. That is the fraud number one that I'm talking about. Number two, we also have an appropriation of a certain amount for fuel and lubrication for the vehicles of the department. But if you critically see and think around what is exactly happening, the department has never fueled an emergency vehicle, to be specific, from Garbatula, unless I personally, from my own pocket, fuel the ambulance so that they carry the sick person to Isiolo General Hospital. If we are appropriating the same amount in our budget, and we do exactly the same under FIF, and those money are not reaching those critical services, under your watch, if you are nominated, how will you going to ensure that these honorable members will not be going through the hardship that they have been facing for fueling the ambulances from the wards? So the fraud part of budget making process and the fueling of those vehicles and the maintenance part must be addressed by the nominee, so that we will see how we're going to handle your case. Thank you.
Thank you, Honorable House, Honorable Member. The budget making process, it's quite a process which I know every member, the assembly is aware of. But now when it comes to the fraud part of it, I talked about integrity. We really have to have that integrity to deliver. Let me specifically talk about the Department of Health that I'll be bestowed the honor to run. The key issue about emergencies, it's really frustrating, to be honest. And why? Because we have these vehicles, they are around. Maybe serviceable or unserviceable. But the few that we have, referring back to the strategies that I discussed about, the key strategy of reviving and strategically allocating to the sub-counties these ambulances, I think can work. Also laying a responsibilities as per the values and principles to a person, because now everything is centralized to one place. Transport is centralized. I think for the health, and I know if we decentralize it to be managed by a health department and holding someone responsible for the emergencies and the vehicles and the fuel, we can easily account for it. Because I think somehow there is a gap in accountability and delivering what we are supposed to do. And honorable members, I'm sorry, I'm also part of the supporting system of the community in giving out this. We really have to be tight and hold our responsibilities, even fearing God, so that you can deliver to those communities. I'll take it as an initiative, I myself, as the CEC, to make sure that the fuel and the emergency vehicles, and also there's something surprising, there are so many other vehicles of the county which are arrived from the previous government, which requires a little resource to just be happened serving the communities in the interior. But I'll take it as an initiative, and after some time I will develop it and see what we will do. But accountability is key. Number two, another response. Have I responded as I was being asked? First, the second one was?
I was asking about the fraud in budget making processes. You allocate money and has never been spent, and you double allocate under the FIF, the fund which have been approved by the county assembly to be used at the source. So those funds has never been utilized, and if so, there has never been accountability part of it.
Okay, thank you. As I said again, the budgeting process is very clear as per the PFM Act and as per the laws of the government. I think there is a gap somewhere which me and others will team up Now that I'm at a position of cabinet, I'll make sure I'll air this and discuss it and solve it. Because also to some extent, these allocations, they are never spent. Maybe it's the shortcomings from the national government submission of the funds to the county or some other reasons. But it's a key area that I will keenly look upon. And joining with the cashews issue, I remember previously, some few months or a year ago, we had a circular from the county secretary's office to stop all the cashews. But then it arose an issue that there are those key areas that cashews cannot be suspended. For example, the mob that you're talking about. I also in the department, the tourism sector, we retained some few cashews. For example, the market guns, because they were being vandalized, we retained a few, but it has really been an issue. I remember once in Chirac we discussed about confirmation of these cashews, and I think it still stands. Only that it was interrupted by the human resource audit that has taken quite a long time, and we are yet to get the report soon. So I think we'll still, in the cabinet, push for it, for those who have served for long to be confirmed, and if they ask also to come to you, the assembly, we will urge you to support us, we confirm them, then we do away with the cashew issues. Also in the health sector, I know they had contracted some cleaners, or the search. I don't really know currently which was the lesser, which had the lesser cost. But when I sit in that seat, I'll be able to see clearly. But for the I can commit to deliver it to the cabinet confirmation of those key cashews around. And also, most of them were paid honorable. It's not that they were not paid. Most of them were laid off, they were paid up to that period. But also the serving ones have a gap, they have not been paid, which is inhuman, to be sure. It is inhuman, and I in the cabinet will fight for it. But I think we should do away as a county and as assembly with issues on cashews. There are some laws about engagement of cashew. You cannot engage a person for over 3 months as a cashew. You can renew after 3 months, but you cannot retain that person for 2 years, surely as a cashew. So there is something which needs to be done, and I promise I'll take it to the cabinet for further discussions, and it will be sorted. Thank you.
I think members, we have come to the end of this session. Lucy, thank you for showing up and answering the questions. We are going to retreat to do our report, and we will get back to the governor to communicate to the governor about the results, the decision of this committee. Thank you so much. Unless you have something to say as a closing remark.
Okay, thank you. I think first I would really appreciate and thank the House for the session, for the conducive environment, for the tough and good questions, and they are also enlightening me on where to go and have a start. Thank you so much for the honor. Also, I really wish to know if it is how we can collaborate the county government and the county assembly of Isiolo. We've talked about the budget process, which is very key and critical. And you've seen after some time we have some supplementary budgets, some misappropriation here and there. Because you are the ones who approve these budgets, how can we sit together and have a collaboration, a line, so that we can be moving with our budget smoothly as we pass it in the assembly, we implement it maybe for that quarter, and then when it comes to the oversight, we do the same and work as a team to avoid all these issues and which are the gaps that are coming up through the budgeting process. Thank you.
So, Lucy, rise hand at your own time.
Session is over.
Thank you. So thank you, one of the members.